Hello, I am Dr. Angela Castellanos. Today we are going to look approach to psychosis. Please notice this video is for educational purposes only. Please consult your doctor before taking any medical decision about your health. We can make a definition of psychosis, describe it as a mental state characterized by a distortion or loss of contact with reality. Positive symptoms of psychosis include delusions, hallucinations, disorganized or abnormal motor behaviors. It's important to consider to make a differential diagnosis as a primary and secondary causes. On primary causes, we can find schizophrenia, brief psychotic, delusional disorders, mood disorders, such as bipolar disorder, depressive episode, and others, and personality disorders, such as borderline, paranoid, obsessive compulsive, and other diagnoses. And as a secondary causes, we can consider general medical conditions such as head trauma, dementia, delirium, tumor, metabolic, infections, or stroke, and substance-induced psychosis. It's important to focus on the psychiatric assessment at the time of taking the patient history. There are 4 points that are most important for psychiatric assessment: the psychiatric functional inquiry, mood, depression and mania, other such as trauma, obsession compulsion, disordered eating, active medical problems, anxiety, psychosis, safety and risk for the patient or others. Past psychiatric history, such as previous psychiatric diagnosis and mental health contacts, hospitalizations, emergency department visits for mental health crisis, suicide attempts, aggression and violence, or legal charges due to behaviors and treatments, pharmacological and non-pharmacological treatments. Substance use history, and it's important to consider the type, the use, and previous treatments, and how this substance impact in the life of the patient, and family psychiatric medical history. The approach to psychosis is differentiate among psychotic disorders and distinguish them from other primary diagnoses with psychotic features. There are 3 important points to consider: symptoms, persistence, and time. On symptoms, we are going to take the primary diagnosis that needs full criteria to be met: mood, depressive episodes with psychotic features, manic episodes with psychotic features. Psychotic considers symptoms in criteria of schizophrenia. The persistence of the symptoms: is there any time when certain symptoms clusters are present without other clusters? And time: how long have the symptoms been present? Also, it's important to consider to make some investigations on the patient, such as count blood cells, electrolytes, creatinine, glucose, urinalysis, urine drug screen, TSH, and vitamin B12. Also consider to make HbA1c to obtain basal levels prior to antipsychotic initiation, and ECG in case of severe antipsychotic effect for cardiac conduction. If clinically indicated, order infections workup, inflammatory markers, and brain imaging. The management of acute psychosis and dementia. It's important to ensure safety of self, patient, and other patients. Have an exit strategy, decrease the stimulation of the patient, assume non-treating stance, and intramuscular medications can be considered such as a benzodiazepine and antipsychotics in that cases where patients refuse to take oral medications. Physical restraints may be necessary in some cases and avoid the use of antidepressants or stimulants. Thank you for your patience. For more information, please see the attached reference.